So, in regards to the government leading the way to be able to adopt virtual care models across Australia, there's a couple of things that can be done. First of all, we have to be able to ensure that clinicians and consumers have confidence in the services that they're being provided. We need to do that by being able to leverage the existing evidence prior to COVID-19, as well as what have we learned over the last 12 or so months during the COVID-19 pandemic, to be able to, with confidence, talk about models of care that are technology enabled to support care outcomes for patients. The other component of this, that to be able to enable continued rollout of virtual care services, there needs to be continued funding. We've seen that the uptake of telehealth, particularly in the primary care space, has largely been led by the adoption of new and broad-ranging MBS item numbers. And there is an opportunity for us to further refine these into the future to be able to allow patients choice in regards to the care journeys that they want and need, alongside their clinicians, in terms of being able to provide them with access to programs that one, suit their clinical needs, but two, also align with consumer desires and the way that they want to interact with the healthcare system. In the New South Wales case, we've got activity-based funding, and there have been adjustments made for telehealth activity across New South Wales. And so that needs to be continued to be reviewed, refined, and support existing and new models of care as they are developed moving forward. Training is incredibly important in the care space, as we have created new models of care or redesigned existing models of care. We need to ensure that our workforce is capable of delivering safe and high quality care regardless of the modality. And so as we undertake this COVID-19 journey, or continue through understanding what has worked well and what are our opportunities to learn out of COVID, one of those is workforce capability. One of the things that we're doing through the Virtual Care Accelerator in New South Wales Health is working across the system with our Ministry of Health colleagues, with colleagues at local health districts and SHNs, around what workforce capabilities are needed for clinicians to work with confidence and with the right skill set for virtual enabled models of care into the future. That may mean looking at how do we better communicate, what settings is virtual care appropriate for, how do we understand as new tech companies come up, what ramifications or what considerations do we need to consider as clinicians around things like safety, around privacy, around understanding algorithms as new AI programs develop. Those type of things need to be embedded at all stages of training through a clinician's journey, not just at university. And we also need to be able to provide patients with education around how their care can be received, to provide them with confidence in the modalities or models of care that we're providing. So in regards to virtual care models and understanding the financial aspects of this, we need to have robust evaluation up front of existing models of care and any future models of care. When we talk about new virtually enabled models, too frequently do we think about evaluation or monitoring once we've already implemented. We need to be thinking about these things really up front, and first and foremost ensuring that the models provide safe and high quality care to patients and the patient cohorts that they're designed for. From a financial aspect of things, if you look at the literature that exists, there's a clear use case around patient travel and decreasing travel, the time lost around waiting for clinicians or waiting for appointments. And there's broader impacts as well around, are different virtual care models able to have impacts on length of stay in hospital in terms of unplanned representations? Can they impact on being able to manage people safely and well in the community as opposed to in high hospital-based care. We know that through existing face-to-face models or more traditional models of care that hospital-based care is very expensive, and where we can provide models of care, and this is not just for telehealth or virtual care, where we can integrate models of care that allow us to keep people well in the community, that will have a financial benefit for the whole of the system. So integration is I think one of the big goals that we need to look at. How do we, I suppose, address some of the challenges of fragmentation between state and federal responsibilities, between primary care and acute care services, and in between clinicians as well, ensuring also that the consumer or the patient is at the centre of care and that they can be an active participant in that. Technology can provide a potential solution for this. In regards to whose responsibility it is essentially a there's no one person, no one agency or organisation that we can point a finger to and say, this is your responsibility. We need to look within our respective jurisdictions, within our respective practices, within our own clinical care, if you're individual clinicians, around how do I better serve my patients, my consumers, in delivering healthcare. And so from a state lens, which is where I focus within the work of the Virtual Care Accelerator, we look at how do we ensure that when patients either enter a hospital system or they leave it, how do we ensure that there's clear communication channels? How do we get communication flowing in, flowing out? And clearly that is a challenge for New South Wales Health overall to be able to look at, and this is being done. We've looked at integrated care programs, and there's been significant funding in these. There's collaborative commissioning, which is I suppose an area that we're putting funding in to be able to address key challenging areas within New South Wales Health. And particularly with that, looking at how do we look at a healthcare continuum from acute care space to primary care, back to acute, and so on and so forth, and ensuring that there's streamlined care for patients. The notion of shared care planning as well falls into this. How do we create better shared care plans, particularly for patients who are most vulnerable, those patients with complex chronic diseases? How do we ensure that there is a concise, clear plan to bring all of that individual's support network, whether they're doctors, whether they're nurses, whether they're allied health staff, working in any realm or part of that continuum, hospital-based, ambulatory care, primary care. And so looking within the New South Wales health realm, there are a lot of opportunities that we can continue to refine, that we can continue to build on the evidence that has been generated, but also look to the future of what are our current challenges? How do we get better communication through to GPs from the hospital system? How do we provide patients with better advice around what happened to them in hospital so that they can also self-manage their healthcare needs when they return to the community?